My name is Dr. Amru Ahmed. I am a clinical oncologist working at Indira Gandhi Memorial Hospital in Maldives. So, cancer care first started in the Maldives around 2018. So, back then, medical oncology was handled by visiting oncologists from medical oncologists from India, and already cancer surgeries had begun. So my senior colleague has started onco surgeries, and he focuses mainly on head neck surgeries, breast surgeries, and GI surgeries as well. So medical oncology was done mostly by a visiting oncologist who would come 3 days in a month, and it would go on like that. But unfortunately, many patients were lost to follow up, and they were not very regular at that time. So many patients had been flown to India and neighboring Sri Lanka as well for their continuation of treatment. In a country of roughly 400,000 people, we have a registered cancer population of around 2,000. And we at present don't have a lot of cancer specialists working. At present, it's me in clinical oncology and my colleague, Dr. Shifan, um, who is specialized in cancer surgeries, and one other colleague, Dr. Hana, who is specialized in gynae oncology. There's also one more foreign medical oncologist working at a private hospital in Mali. So we do have a scarcity of doctors when it comes to treatment of cancer patients, and it is challenging when it comes to the follow-ups and complications, and we are in great need of other cancer specialists. In the journey of a cancer patient of Maldives, even up till now, the full treatment of cancer cannot be completed in Maldives mostly. But as I mentioned before, uh, PET imaging and radiotherapy and these kind of treatments, the patients go abroad, and they need to travel abroad. Um, However, in our country, we do have a national insurance scheme called Asanda. So they cover the majority of the costs that patients need to bear for their cancer treatment. And if treatment isn't available in the country, they do provide assistance to seek treatment in neighboring countries. So in this way, many patients travel to India and Sri Lanka for the treatments that are not available in our country. We have been collaborating with many hospitals in India, especially in the south of the country. So a lot of patients travel to these hospitals for their treatment, and it has been a very good partnership for us, because the hospitals do check up on our patients even after arrival back in their home, and we talk extensively. We have a lot of clinical discussions and multidisciplinary meetings uh, for the ongoing cancer treatments of these patients. So in the future, I look forward to expanding these partnerships when it and my job as a local oncologist would be definitely helping our country get on their feet when it comes to healthcare provision. And I think India has been a very trustable partner for that to happen, even from the early days of healthcare and up till now. And I think the support that we are getting will be continued when we start to expand further into many different sub areas of oncology.